Okay. Okay. Alrighty. Oh gosh, let's see. Okay, there we go. All right. Hello, everybody. This is Desiree here in HR at the Family Place, and I'm really glad that you could join us today virtually. We are going to be talking today about sexual assault and growing our knowledge. And this is especially important because it's Sexual Assault Awareness Month. And today we are joined by Megan Morales, who is joining us from DARCC, which is the Dallas Area Rape Crisis Center. DARCC has been serving the Dallas and Rockwall and surrounding counties for 10 years. This is their 10-year anniversary. And so we are going to do a little bit of information sharing. We're going to ask a lot of questions, and I'm really excited for you guys to be able to grow in your knowledge. So I'm going to go ahead and get us started. The very first question I'm going to ask is, I'm going to welcome Megan a little bit more. So DARCC provides advocacy services, community outreach and education, counseling, and hospital accompaniment to survivors of sexual violence. Megan's here with us today. She's the director of advocacy over there, and she has been privileged to serve in that capacity with survivors of sexual violence for over 5 years. And at DARCC, she supervises the 24-hour hotline, medical and legal advocacy teams, and direct client case management. So welcome, Megan. I'm glad you're here to join us today. I know you have a ton of knowledge to share with our staff when everything kind of seems off kilter right now. Unfortunately, we know that domestic violence and sexual assault doesn't stop simply because of coronavirus. I know here at the Family Place, we've seen an increase in lethality and like the number of clients who are reaching out to access services. Can you talk to me a little bit about DARCC and what they do during normal times, the times that are just standard?
Yeah, so you gave a good summary of the advocacy department. So we've got our 3 main departments, the first one being advocacy, and that is our 24-hour hotline, our hospital accompaniment. We have a full-time legal advocate and legal advocacy program. That also includes case management, walk-in crisis intervention, and then that also includes our volunteer coordinator and our volunteer program. And then we have our outreach and prevention team that are out in the schools and churches and different communities, teaching about healthy relationships or tabling events. We also have a training coordinator who does law enforcement training. And then we have our clinical department, and they do individual and group counseling.
Awesome.
Yeah.
And then that is so many services. I love that. Talk to me a little bit more about what hospitals DARCC serves in the North Texas area. Can victims just go to any hospital, or how does that work?
So even though there's the law that states that every emergency room needs to be able to provide this kind of exam, there truly are only 3 hospitals in Dallas County that will do a SAAM exam, and those are Parkland, Methodist Central, and then Texas Health Presbyterian of Dallas, which is the hospital that we serve. And so those are the only 3 that will do an exam. If you go anywhere else, ideally at the front end, they will and it's not good to turn anybody away, but let them know that they can go to one of these other hospitals, or sometimes they'll admit them and then they'll transfer them to a hospital that will do the exam.
Okay. And so talk to me a little bit about, just for our staff's kind of edification, what would it look like if we had a victim of sexual violence who was here at the Family Place and they needed a SAAM exam? When they went to one of those hospitals that does a SAAM exam, or say they go to Presby Dallas, will you walk us through what that process would look like during normal times, who they interact with?
Yeah, so as soon as they get to the hospital, they tell the person at the front, which is always uncomfortable, but that they're there for, that they've been sexually assaulted. And at that point, they're triaged, and they're triaged at the highest level. And so basically that means they just want to check them to make sure there's no life-threatening injuries. And then they put them in a room, and at that point they ask if they'd like to make a report or not to law enforcement. If they do, they will call law enforcement, and an officer will come out to take a report. At the same time, they ask them whether they want to report or not, and possibly dispatch law enforcement. That's also when they call our hotline, and one of our advocates are dispatched. And then either, depending on the time of day, there are a few full-time SAAM nurses that are there that are specially trained to do these exams. And so if one of them are already there, they're notified and can start setting up their room and that kind of thing. And if they're not there, then they call in whoever's on call for that. So once they all get there, like I said, the nurse will start setting up the room. We'll go in and talk to the patient and kind of just, first of all, make sure that we can't get them something or call somebody. The majority of the time, people are by themselves. So, seeing if there's any kind of support system there that we could help with. And then going over what the process is going to be, answering any questions they might have, letting them know what to expect. And then the nurse, once the room is ready, will come over to the ER and where the patient is, and go over the exam and have them sign some consent forms. And then we will all go over to the same suite that we have for the actual exam. And that's when they'll start by going over the history, just like a medical history generally, that kind of thing. And then they'll get the story of what happened, and they'll get it in their own words. And so the nurse, they used to write it out, now they get to type it, but they type it in their exact words because that's what will be used if something were to go to court down the line. That is what that nurse will be testifying to. So it's kind of a longer process to take that history and take an account of what happened. It also helps them know where to try and collect evidence. If they, if they were kissed on the neck, make sure that they could be swabbed there, that kind of thing. And so it's helpful for a number of reasons. They also, then they're checked over from head to toe. They get a pelvic exam done and a bunch of pictures taken. They take at least 3 pictures for every bruise or injury. And then once the pelvic exam portion is over, they are allowed to shower if they want to in the same suite. There's like a private area where they can shower, and we can provide them with any clothing if that was taken away, or toiletries, things like that. And then they'll sit down with the SAAM nurse and go over medications and what they might need. So if they need antibiotics to prevent STDs, if they want to take Plan B, that kind of thing, and then or HIV preventative medication, which is a lot longer of a process and a lot more things you have to go through. It doesn't happen very often that they give that out. And then once that's decided, the patient goes back over to the ER. The SAAM nurse lets the doctor know what medications they decided on. He writes the order. We'll go back, as the advocate, we'll go back with them to the ER. We'll help them fill out crime victims compensation paperwork, which is what pays for their exam and the hospital stay so that they don't get a bill for any of it. And then we go over our resources with them. We have a packet that we give to them that explains everything. We safety plan, make sure we know, are they going, do they need transportation? Where are they going? Who are they going with? Do they feel safe going there? Do we need to help them find a shelter? So we do a lot of those kinds of things. And then they're given the medication and they have to wait a little bit just to make sure there's no reaction, and then they're discharged. I hope that wasn't too much detail, but.
No, that's perfect. I think for so many of us, people say like, oh, they're going to go get a SANE exam. But those, after saying that word, like what that actually entails or how difficult that can be for victims, I think that many of us just don't know what that looks like once they leave our offices to go do those things. So I think that's a perfect kind of window into what that looks like in practical application. And so I know that you guys have had to adopt your services kind of during this time of coronavirus, and you did just such a good job explaining what it looks like normally. Now, what have you guys had to do, or how has DARCC adapted to still meet the needs of survivors of sexual violence right now, but with some limitations that I bet you guys have?
Yeah, so our biggest limitation and what I think about the most is that at this point in time, we are not allowed in the hospitals for the survivors that come through for an exam. So they do not have an advocate with them through the process. And like I said before, we keep track of how many people come in with a family or friend member versus coming in alone. And the majority of the time, they're coming in alone. And so the fact that they don't have an advocate there is unfortunate. But right now what we're doing is the SANE nurses are explaining, what an advocate is, and then they are calling our hotline, and an advocate that is trained to be a hospital advocate talks with them and goes over their rights, make sure they understand CVC, make sure they know we get their information for follow-up services, so for counseling or legal advocacy or anything like that. And then we'll have our regular case manager and clinical team follow up with them just like we would any other patient that we saw in person. So, and then right now we're having the discussion of whether we could do some sort of FaceTime, because that's how it's done with the interpreters. There's just like a little iPad robot that a person puts on and translates. And so possibly doing something like that, not for maybe the whole exam, but at least so there's that face-to-face connection. So that's something we're working on. And then as far as our other services go, we are moving right along. Everything is done virtually. We're using Zoom as a HIPAA compliant. And so we are doing our individual counseling. We are still holding our group counseling sessions online. Our prevention and outreach team is busy. They're doing weekly webinars, and we hold volunteer training, which is a 40-hour training that all of our volunteers have to go through and our staff have to go through. And we're going to be doing that completely virtually for the first time. So that'll be really interesting. Yeah. So we're really we're doing happy hours with the volunteers. We're just trying to be as creative as we can and still provide as much of those services as we can, still doing intakes. And so.
Awesome. I love that. I know. I feel like we're all just kind of having to kind of shuffle around and figure out what we're doing and coming up with the best solutions right now. Now, if we have a victim who is afraid to go to one of these big hospitals right now because of COVID-19, are there any alternatives for them to get a SANE exam in North Texas that doesn't involve a hospital?
Yes. So in Collin County, there's a place called Courtney's Safe Place. Mm-hmm. And it is a freestanding clinic. The Turning Point Rape Crisis Center in Collin County, it's attached to their offices. And so they do exams there. They will give them the medication there, do the exam there, all of that. And so in our most recent SART meeting, that virtual SART meeting that we had with everybody, we were talking about that and trying to, if we get the opportunity over the hotline or wherever to talk to a survivor that wants to go get an exam, to let them know that they can go to Courtney's Safe Place, and that way they're avoiding the hospital process. They'll have an advocate and a SANE nurse. It's a really awesome facility, so it's a really good option for people that don't want to go, obviously to the hospitals right now.
Absolutely. That is really great. So also kind of in the same vein of things, we know that DV calls have increased a lot during coronavirus and COVID. And I know that there's been some kind of talk among our staff is wondering, like, with kind of coronavirus going on and people maybe not knowing about Courtney's Safe Space, what are you guys seeing in regards to like sexual assault calls and people going to the hospital? Is this kind of putting a barrier up for them?
Yeah, so for us, so I was on a call with, I don't know, there were like 300 and some people there, rape crisis centers all across the country, just to talk about COVID and what they were doing and numbers and things like that. And we did see a slight increase in numbers in March as far as people coming through the hospital, and as far as hotline calls go, but it wasn't significant. And across the country, what they were saying is that some places have seen a small increase, but for the most part, numbers are kind of down. But in the last few days, as things as a little more time has gone on, it's started to kind of uptick again. But they're expecting a really high spike in calls and things like that once these restrictions are lifted. And so even though we know it's still going on, and especially in this environment right now where everybody's sheltered in place and those factors, we're not quite seeing that yet in the numbers.
Okay, good. And I know you kind of changing track a little bit. I know you mentioned that your agency is engaging staff and the community during this time. Are there any public webinars or activities that we can send our staff over to?
Yeah, absolutely. So I can put together a little page or send you our newsletter that has all of them in there. But yeah, we do our training. Our outreach team is doing community webinars and things like that, trainings and stuff like that that are open to the community right now.
And I think I saw like a Netflix watch party or something on your Facebook.
Yeah, so they're doing a streaming party. I don't know what the exact word for it is, for the documentary Roll Red Roll, which I can never say that without getting my tongue tied, but they're going to screen that and then have a discussion.
Awesome. And I'll make sure our staff, I'll put it in the links that'll be attached with this webinar. Yes. I think that's such a cool way to engage people.
Yes.
So thank you for talking to us about kind of the important and timely information. Since I have you on the line, I also wanted to dig a little bit into some of the big things that happened in the field of sexual assault in this past year. So we here at the Family Place have a course in our learning management software, which is called Learning Place, that is accessible to all of our staff, that covered some of the big legislative changes in Texas that came out of the 86th legislative session. And I'm going to be honest, I was really blown away at some of the big steps that were taken for survivors of sexual assault. Being in this field and working in that every day, what did you think was some of the biggest wins or one of the most impactful things that came out of the last legislative session here in Texas?
Yeah, so just a few of them. I mean, to start, I think they put it was about $75 million was added to the budget for with sexual assault priorities. 60 million of that being for the rape kit backlog, so really important. They talked about, or they made it so that the sexual assault kits have to be tested within a 90-day period and has to be uploaded into CODIS. They made sure to extend the time that a survivor has to get an exam after an assault from 96 hours to 120 hours. They made non-penetrative sexual assaults such as groping finally a Class A misdemeanor for indecent assault, and so that was exciting. But I would say probably the biggest thing, at least for me, that I think is really cool is there were a lot of laws passed about DNA collection and being able to track sexual assault offenders, serial offenders. And so the new law expanded the list of crimes that someone would have to give up their DNA for. So robbery, assault, different things like that, that previously they wouldn't have to give their DNA for, they are now, and it's being uploaded into the system. And so, and one of the statistics that we know is that at least, so more than half of all alleged rapists have at least one prior conviction. And that's for anything, not necessarily sexual assault, but something. And so if that is the case and they're getting their DNA and then they're matching it to these kits, it can be a really awesome way to identify some serial offenders. And we also know that the majority of sexual assaults are committed by a small group of people. A small group of them commit most of the sexual assaults. And so to be able to have this database and everything, I think it's already been very successful at identifying a lot of serial rapists. And so I think it's going to be really helpful in the future. So I would say that was probably one of the biggest ones for me that I thought was awesome.
Yeah, no, I totally agree. So kind of part of that, when you mention like serial offenders, I think about the, it's called House Bill 8, but everybody, it's got a kind of a tag name of the Lavinia Masters Act. And so here at the Family Place, Lavinia was presented with our Real Life Hero Award this past year for the work that she's done in the field of violence against women. So I'm going to recap just a tiny bit for our staff. Lavinia was a victim of sexual assault at 13 years old by an intruder in her family's Dallas home. She had a forensic exam done, like what Megan explained to us earlier, and that kit sat untested for 21 years, which was long past the statute of limitations at that time. In 2005, she learned what happened to her kit, and then law enforcement also told her at that time that the perpetrator in her case had gone on to commit and be documented committing 2 more rapes of women. And so she went on to lobby for a bill that was signed into law here in Texas, which was House Bill 8, or the Lavinia Masters Act. And it established some of these timelines Megan was talking about. It established a timeline for the collection, preservation, and submission of forensic evidence for analysis, and it extended the criminal statute of limitations for sexual assault cases where the evidence had not been tested and submitted for analysis. It also required a statewide audit of untested evidence kits and authorized state agencies to condition grant awards to law enforcement agencies on compliance with that law. And so Megan talked about like the importance of some of this, and House Bill 8 also includes the SAAM kit utilization tracking, like it's a tracking system for SAAM kits. And we heard and were told by the Dallas DA's office that Texas's utilization as a state of that tracking system is over 12% right now, which seems kind of low, and I feel like we could do better. But they told us in comparison that states who are using the same type of system are having a less than 2% utilization of this tracking system. And I know it's something that your advocates are talking to people about. Can you talk about some of the reasons you feel that might be contributing to why Texas is succeeding in really having people engage with this system, and what kind of difference that makes for victims?
Yeah, so I think that it's a combination of things. I think the medical facilities have been good at getting this information out. Law enforcement has been good at giving this information out. I mean, I've sat in so many initial interviews where even patrol officers have brought it up, which
Yeah.
that's really shocking sometimes. Good, but surprising. And then I think it really there's a lot of credit that goes to the advocacy groups that are putting that information out there. I know for us, it's something that we go over with every person that comes into the hospital. It's part of the resources we give them. It's part of the things that we talk to them about. The SAAM nurse talks to them about it. So I think it's something they're hearing over and over again, at least throughout Texas and definitely North Texas. And there have already, at our last SAARC meeting, we were talking, and there's already been a huge chunk of cases that survivors have logged on to see where their kit is in the process, and have seen before the officer that it was completed and ready, and has led to arrests or convictions. And so it's already shown to have a really positive impact. And I think it's good. It allows, I've seen some survivors that they don't want to know. They're like, take my kit and just go. And I don't want to really know anything else about it. But a lot of them, they've lost this control. And I think it's another little small way to give them a little bit of control back. And just so that they know it's in process. It's not just out in space and it never, no one's checking on it or paying attention to it. So I think it's a really cool addition, and I'm really excited that people are using it.
Yeah, we were really excited when the Dallas DA's office came here and kind of talked about some sexual assault updates. And I was really glad to hear them talk about it, and then kind of be really excited about it as well, to have that kind of systems buy-in, which is really hard sometimes. And
there's a person who's dedicated just to this, and she was at our last SAARC meeting. And so she communicates with survivors on a daily basis, back and forth about, where their kid is, helping them figure the process out, and that some other states and regions don't have. And so I think that's also really helpful.
That is, I love that so much. Well, that is kind of, I had one more question. So you talked a little bit about them changing the length of time that survivors can go to receive testing. So for our staff, that's House Bill 616, and it changed the length of time for testing from 96 to 120 hours. Can you talk a little bit about why that change is important and how that's going to impact survivors and their ability to give reports, get exams taken, and potentially justice down the road?
Yeah, so for Texas, we've been doing the 120 hours for some time now. The law wasn't quite caught up. And so it's good. It used to be that it was 96 hours for non-reports. And so now it's 120 across the board. And so, as we know, survivors don't always report right away. It takes some time to figure out what happened, figure out what they want to do. talk to somebody in their support system or call a hotline. I mean, there's a lot of things that can go on in that time period, and the different kind of emotions and feelings, and they're going to go through after trauma like that. I think it's good that they have a little more time to make that decision. And I think that it allows the advocacy groups to maybe have some interaction with them in that time and be able to give them the right information they need and whatnot. I don't know. Did that really answer your question?
No, I think that's perfect. I think that for our staff, they understand that the dynamics of trauma and just kind of things leave victims and survivors kind of reeling and needing to process through things. And so I think that that extra time frame just gives them a little bit of grace to kind of sit with their experience and make some educated decisions on what they want to do next without, you know, kind of putting extra barriers in their way or making things, you know, a little more difficult than they need to be. And the science backs the 120 hours. And so I think that that's a great thing that Texas kind of rose to the occasion to understand the impact of trauma and trying to give them space in that.
And show them that I hope that it shows that, you know, we want to give you an exam. We want to help you. And so extending that time to the very, you know, if science supports that to the very, as much as it possibly can, I hope that says something to survivors too.
Absolutely. I agree. Well, thank you so much for doing this with me today. I'm going to kind of give a couple of bits of information. I hope that our staff was able to gain a lot about the sexual violence field and specifically about what we're doing here in North Texas. As a reminder to everybody, both DARCC and the Family Place are still operating during this pandemic to meet the needs of survivors of domestic violence and sexual assault. If you need to get in contact with DARCC, they have a 24-hour hotline, which is 972-641-7273. And of course, you can always reach the Family Place at 214-941-1991. Again, thank you, Megan, and we can't wait to hear from you guys soon.